There's little doubt you've had negative interactions with people in addiction. I want to give you an explanation, not an excuse, but an explanation of the disease model of addiction that may help explain certain behaviors. I'm Bryan McCauley, and I'm a senior trainer with the Phoenix Training Program at St. Joseph's University Center for Addiction and Recovery Education. I'm also a Marine Corps veteran and had careers in both the police and fire service. Let's consider a person suffering from the serious mental health disease schizophrenia. It's often recognizable in public as we see the person in psychosis, suffering from a break in reality. The person may be arguing with someone that isn't there. We would not walk up to this person and ask them to just stop and point out that nobody is there. We understand that this is the person's reality and we cannot simply change their mind. We can find this illness outlined in the Diagnostic and Statistical Manual of Mental Health Disorders, known as the DSM-5. This is a manual used by mental health professionals from drug and alcohol counselors to MD psychiatrists. We get standard classifications of mental disorders as well as assessments and diagnosis, like schizophrenia is listed on page 87 of this book. Now let's talk about another disease outlined in the same book on page 481, substance abuse and addiction. Addiction is defined as a chronic relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It is considered a brain disorder because it involves functional changes to the brain circuits involved in reward, stress, and self-control. Same book as schizophrenia 400 pages later. Yet we continue to challenge people with addiction. Why don't you just stop? Some even assign blame to the person as making a bad choice. Just because you don't see people in addiction exhibiting behaviors like a person with schizophrenia doesn't mean that they also don't have a voice in their head. And that voice is saying one more. Addiction basically hijacks the brain. A person with addiction behaves the way they do because there are physiological changes that take place. There are two parts of the brain that typically communicate. You have the prefrontal cortex, which is responsible for reasoning and judgment. It's the smart part of the brain. And then you have the limbic system, the pleasure center of the brain. It's where the feel-good neurotransmitter dopamine is released from. While both parts of the brain have a role, the prefrontal cortex in a normal, non-addicted brain, it runs the show. It's the reason why I've never eaten 10 Reese's peanut butter cups in one sitting. As much as I love them, I receive the reward from one or two, and then my prefrontal cortex signals that I've had enough. To continue eating would cause me to feel sick, guilty, perhaps, and over long term, it would really be bad for my overall health. But once a person crosses that threshold from abuse to dependence, the prefrontal cortex and pleasure center stop communicating properly. It's the disconnect that is the disease model of addiction on the most basic level. Things usually necessary for survival, like family, love, and even eating and drinking water, become secondary to the need for drugs. The prefrontal cortex still functions, but the roles are reversed. A person's thought processes are now made in the pleasure center. We all know what this looks like: manipulating others, engaging in risky behaviors like stealing, doing whatever it takes to feed the addiction. The person with addiction will put everything aside, their job, their family, all because the chemicals they use to create enormously higher levels of that feel-good dopamine from the limbic system. No healthy, natural life experience can possibly compete with the dopamine levels seen when we use those substances. Yet there is hope. Once a person engages in professional treatment and finds success in not using substances for about 18 to 24 months, the brain returns to normal. Just like other chronic relapsing diseases, if the person does not commit to recovery, the symptoms will return. If I have diabetes, let's say, and I stop my treatment, I would have a reoccurrence of my symptoms. The problem with addiction of all types is that voice, just one more. Reese's cups, for example, don't have that same addictive behavior that heroin does. Heroin says, just one more bag of heroin. Or other addiction, just one more beer, one more pill. I hope that this gives you a better understanding and possibly a different perspective on the disease of addiction, or maybe a reminder that there is a human being behind the addiction. Either way, you can make a difference in someone's life just by how you speak with them. I challenge you at the start of your shift today to find someone in your community in active addiction. When it is safe for you, and only when it is safe, engage that person in conversation and share your thoughts about substance use disorder. Ask if he or she is ready for treatment, and if so, make a phone call to connect that person to professional treatment. If they are not ready, deposit some hope. Let that person know that treatment does work and that he or she can get healthy. Please contact the Center for Addiction Recovery Education at St. Joseph's University for additional training on how to connect people to professional treatment.